Everyone that I knew was coming for sure is here. So we can go ahead and get started. So thank you everyone for joining. For those who are guests today, we're really excited to have you guys join along with us. So was thinking about people that I wanted to come chat with us, and I was thinking about some gaps that the faculty have identified in the program, and then thinking about what's currently going on. I had been wanting to have Kylie come talk to us for some time, and so this timing just worked out really perfectly. So long story short, I got to know Kylie when I was working as an athletic trainer in Texas over her dog, and then I gave her the wrong cell phone number. It's a whole thing. But in the process of a year, she became one of my really good friends, and I actually gone down and saw her a couple times down in Texas. So I'm really excited to have her here. I'll go ahead and pin her to the front so you guys can see her during most of the talk. And then it's going to be kind of question and answer. So I have some questions for her, but I know that you guys probably have a lot of questions too. So Kylie, to make sure that I do justice to your intro, I'm just going to let you introduce who you are, your education, and what you're currently doing for employment. So thank you again for coming. We're really excited to have you here.
Yeah, of course. So like Beth said, my name is Kylie. I am a licensed professional counselor intern. And so real quick, a lot of times people get confused on what that intern part of our license means. And so if you equivalent it to like a doctor, so I'm in like my residency. So, like with doctors, they go through their intern stage, residency, then attendings. And so my intern stage is actually through my grad school program. So at the master's level, while I'm in school, that's when we're considered like an intern. And then once we graduate, we have to sit for a license, which is the National Counseling Exam, the NCE. And then once we pass that, we have to get 3,000 supervised hours. So 1,500 of that is direct, which is face-to-face. And then the other 15 is just like administrative indirect hours. And so once we complete the 3,000 hours, then we can drop the intern name of our license, and then we're fully licensed, which would be a licensed professional counselor. So I am currently 200 hours away from that. And so usually it takes anywhere from about 18 months to you have up until 5 years. But that's kind of where I'm at right now in the process. And so still considered an intern, but very close to the full licensure. And so like Beth said, we met out in Abilene. I was attending Abilene Christian University, where I got my master's in clinical psychology. And then I also took enough hours to where I could get the counseling psychology degree as well. And then, let me grab it real quick. So like Beth mentioned, we bonded over my dog. This is Stella. But part of the reason I'm bringing her on, not only because I'm obsessed with her, but she is actually a certified therapy dog as well. And so in my counseling practice, she sits with us, with me and my clients. And a lot of times she'll sit over by them. And if I have someone who's really anxious, she'll like lay her head on them. So like if they're bouncing their leg, they'll kind of like stop and then channel their nervous energy through her, just like by petting her. But just wanted to introduce her as well. And so her certification, she is a community canine good citizen. And then she just has a therapy license as well. So yeah, that's kind of a little quick intro for me.
Awesome. Well, one of the things that we had talked about within athletic training that we're having to shift to right now is the use of telemedicine and telehealth encounters, because we're obviously not able to see our patients. Can you talk a little bit about your background with this and how your clinic has adopted and adapted during this time and during regular, potentially clinical hours too, to utilize this as some of your therapy options?
Yeah, so whenever this all first started happening, so I'm in a private practice with 4 other ladies, and so our boss had like emailed us saying, hey, I'm gonna start, because she just had a baby, so she switched immediately to strictly telehealth services. And so I was actually a little bit on the fence of it, just because with therapy, it's a lot about the relationship that you build. And while I can still like see my clients over telehealth, it's really hard to gauge like body language, because I work with a lot of teens, and so a lot of teens, they like sit real close up to the camera, or they're laying in bed and have it like just on their face. And so it's hard for me to gauge like their body language and their expressions that they're doing through that. And so I had not worked with telehealth prior to this COVID-19 stuff going on. And so at first I offered it to my clients. I said, hey, if you're not comfortable coming in the office, I can do telehealth services, but if not, I'll continue to see you in person. But then Dallas got hit really hard with the COVID stuff. And so I made the decision to protect not only myself, but my clients to just go strictly online. And so it's been quite an adjustment. I've actually seen a decrease in my clientele just because I have people who are paranoid about like, oh, like, I don't know who's going to be listening. I have other people who they just prefer the face-to-face, but then another barrier to telehealth services is the confidentiality. And so like right now, my husband is having to work from home also. And so I'm just in our bedroom doing sessions where he is out in our living room. And so while he's not listening, that's like a confidential barrier because who's to say he can't hear me right outside the wall? And so the same thing goes for our clients as well, is let's say I'm working with a teenager at home and they have like 3 other siblings and both parents are home. It's really hard to keep that privacy, especially if one of their issues is with their family members. They're not going to want to talk about that knowing their family members like right next door, maybe in the bathroom that they share. And so that's been a little bit of a barrier, but we're kind of just trying to adapt just like everybody else is. Um, yeah, does that answer your question, Beth?
Yeah, absolutely. And what are some of the potential like solutions for some of those problems that you mentioned that you've been working through with your clientele to help reduce either some of the confidentiality issues or allow them to be potentially in a safe space that they could talk with you?
Yeah, so one of the big things that I tell all my clients is it's helpful if you have headphones because that way no one is hearing what I'm saying. And then also too, they can kind of like speak into their microphone like if they want to whisper something. But I have a client who it's one of my teenagers and her parents don't know that she's a part of the LGBTQ community. And so what we've done is like if I want to ask her a question regarding that, even though she's wearing a headphone, she's like super paranoid that they're listening. We'll type it in the chat that the telehealth service provides. And so I use Zoom with some of my kiddos because that's what they're used to for school right now. I use another program called Doxy, and it's another kind of just telehealth platform. But both of those have a place where you can type in chat, and so like we can type, hey, let's use this code word for if we're talking about this, or they can type me the answer to the question I ask if they don't feel comfortable answering out loud.
So one of the things that I really wanted to chat a lot today is much like with counseling, we have that very personal relationship with the patients that we see day to day. And I know you actually have a really good understanding and appreciation of what athletic training actually is between you and your husband being involved in sports. So you understand that relationship that we have with our patients.
Yeah.
What type of things do you think that we should be looking out for our patients and or peers at this time during social distancing, potentially quarantine for some people? And we'll do coping mechanisms a little bit later and some like mechanisms to help, but what should we be looking out for, like being extra observant for in any sort of communication that we have potentially with our patients at this time?
Yeah, so athletic trainers have a really neat opportunity to build those connections with y'all's athletes, just because a lot of times you're seeing them daily, like before practice, after practice, when they're at their best, when they're at their worst. And so y'all have a really great opportunity to notice when there's a shift in someone's mood or behavior. And so I know that it's probably a little bit different right now, just because of COVID. So I don't know if y'all are able to see them in person or kind of how y'all are approaching that. But regardless, you can still see a shift in their mood or behavior. And so, especially right now, while people are having to social distance and isolate, that can be really, really hard for someone who is used to working like in a team or on a team. If they're used to being around other athletes and being social. And so the big thing to look for is their shift in mood or behavior. Are they isolating even more? Like, are they not responding in group chats? Are they not responding to teammates reaching out, to you reaching out? Have they lost motivation in their treatment to continue doing exercises at home that you've given them? Have they stopped doing proper hygiene stuff? Now, I know it's when we're in social isolation, it's really easy to not want to shower, not wash our hair, just kind of like, I don't know, be ourselves and not have to really do anything. But is it getting to the point where they've like completely started to neglect themselves? And so the big thing, like I've mentioned a couple times already, is just the mood and behavior. But then also a sense of like hopelessness or helplessness. Um, so like when they're at home, are they not doing anything at all? Are they just sitting on the couch watching Netflix and nothing else? Are they engaging with people? Like as much as they can, like through video chat, through texting and things like that. And so the big thing is just their shift in mood and behavior, because you know them so well, because you've worked with them in training.
So one of the things that specifically the Xavier athletic training students are doing, and I tried to make as best of an attempt to this as I could. So we're trying to do some sort of like self-care aspect a week to try to make sure, because it's also equally as hard for all of us and for you too on this side of things, that we're used to being in that social environment. We're used to being around people, seeing our friends, our family, everything like that. And a lot of that, even potentially some people's identities have kind of gotten shifted a little bit. So one week we worked on, you could do anything you wanted for 15 minutes. It just had to be some sort of you self-care. Last week we did a little bit of meditation, and then this week they just got it posted this morning, so they might not have seen it, but it's daily gratitude and setting reminders on their phone to be grateful for 3 different things throughout the day.
Yeah.
Can you talk about maybe some different options or other types of potentially what you might do with clients at this time if they're experiencing some potentially signs or symptoms of, anxiety, depression, some of those feelings of hopelessness that you were talking about?
Yeah, so self-care is something I've been talking about a lot with my clients. It's already one of my favorite things to talk about, but especially during this time. And so I actually sent out a weekly email to my clients talking about 3 things. One, the importance right now of keeping a routine. So it can sound monogamous or kind of boring, but it is so important right now to keep our routine. Because once we get out of that routine and like just sleep until noon, wake up, eat pizza for breakfast, binge on Netflix, and then stay up till midnight, 1, 2, 3 a.m., and then go to bed and just do the same routine, we can start to get very stagnant and not be exercising our mind or our body the way that it's used to, which can make us feel very lethargic and feel start to develop very depressed and sad feelings. And so a big thing right now is keeping a routine. So you don't have to necessarily get up as early as maybe you were, but developing some kind of routine, like, okay, I'm going to wake up at 8 a.m. I'm going to cook myself some breakfast. I'm going to take my dog on a walk. Then I'm going to start working on schoolwork. Then I'm going to check in on my athletes, see how they're doing. Then I'm going to do this, then that. And so it's really important to keep a routine because it helps equip us to deal with change a lot easier. And then also it helps us develop healthy habits, which will improve our mood and overall well-being. And so right now, keeping a routine. The second thing is making sure that we're keeping connections with people. And so I know everyone's a little bit different. Some people are super introverted, some people are really extroverted. But it's really important, regardless of where you fall on that spectrum, to keep relationships and keep those connections. So texting family members, texting your friends, checking in on your athletes, people who you maybe you're used to seeing daily that you haven't talked to in a while just because of the social distancing. And then the third thing is kind of like you mentioned, Beth, I love that y'all are doing the gratitude journal. That's awesome. But keeping a positive mindset. I know that it can be really easy right now to watch the news constantly and then start to feel really down and depressed of what's going on, not only in our nation, but just in the world in general. And so kind of limiting yourselves to how much social media you're using, how much news that you're watching. Because unfortunately right now it can be just a lot of negative things. And so making sure that we're balancing learning and staying up to date with what's going on, but then also not drowning ourselves in it to the point where we feel really depressed and upset just by everything that's going on. The gratitude journal, that's one thing that I like to do with clients. The other thing is something that's called behavioral activation. And so whenever I see a client that is depressed, And if anyone has ever been depressed or had those depressed feelings, it's really hard to find motivation to do things. If you have an athlete who has an injury and they're not able to participate in things, do y'all often find it hard to get them motivated to do things? Yeah. And so just finding behavioral activation is where you set times in your schedule to do things. And so the point behind it is, even though we're not motivated to do anything, we have it in our schedule. Okay, so I'm scheduling a walk with my dog at 12 o'clock today. And so if it's on our schedule, we're more likely to do it. And if we have someone holding us accountable. And so a lot of times I'll have them like tell me 3 things that they're going to try to do this week, or until the next time I talk with them. And so 1, scheduling it, and then 2, having someone hold us accountable. That way we have a little bit more of that extra push and that lack of motivation that we're having for ourselves, kind of getting like extrinsically. And so scheduling stuff, that's really good. I'm trying to think what the other thing was. I just lost it. It'll come back to me in a minute, but yeah.
And if you guys didn't know, one of the really cool things available right now for all athletic or for all healthcare providers who have their NPI number and account student NPI numbers too, is the Headspace app is free right now for the 2020 calendar year. So it's normally like, I think like a $75 or $100 subscription for the year. But every healthcare provider with an NPI number can get it free. So something really cool if you guys are interested to download. We're probably going to end up using it in class at some point because it's free. And so why not at this point too? But just something that if you have, if you're talking to other healthcare providers at this time, because this is something, I have a lot of friends who are working at hospitals right now, and you guys probably know a lot of people too. And so it's something that can be hard on them because like typically, I'll speak for athletic trainers, it's not something we do all the time, being in the front lines of some sort of big emergency type of risk management type of issue. So Kylie, we get just a little bit of like scratching the surface of behavioral health conditions in an athletic training program. So typically just kind of put it in the back or out there, we're pretty much trained to know signs and symptoms to be able to refer in a proper manner, whether that's an emergency referral or more of like a traditional clinic referral. But I'm stealing this from your bio a little bit, how you typically do a lot of cognitive behavioral therapy and dialectic behavioral therapy. Could you talk a little bit about what those 2 types of therapy are, and potentially, and maybe not even just now, but just even in your general clinical practice, kind of what those theories centralize around? That way we can get an idea of what potentially clients are actually going through during a therapy session.
Yeah, of course. So cognitive behavioral therapy, otherwise known as CBT, it deals with our thoughts, which is cognitive, and the behavioral, our actions. And so what that's typically looking at is, usually I have a whiteboard when I draw this, so you have to excuse all my hand motions. And so typically the easiest way to describe this is our thoughts, our emotions, and our behaviors are all connected. And so so kind of imagine, as I'm doing my hand motions, like a triangle. So we have thoughts up here, emotions right here, and then behavior right here. And so whenever we have a thought, that typically leads us to feel a certain emotion. And that emotion that we feel typically leads us to behave in a certain way. And then when we behave a certain way, then it typically leads us to think a certain way. And so it's like a continued pattern. And then at the same time, if we feel a certain way, maybe it's causing us to think a certain way. And then when we think a certain way, then we behave a certain way. And so it's just like a continued, and it can go either direction. And so an example I like to give, which is kind of trivial, but let's say that I took a test and I like royally failed it. And so my thought process is going to be, I'm probably thinking, wow, I'm stupid. I'm going to flunk out of college. I'm not going to get the job I want. I'm an idiot. So those thoughts would probably lead me to feel disappointed, maybe sad, upset with myself, maybe hopeless. And then those hopeless feelings would lead me to go buy, I was going to say Bluebell ice cream, but up north, y'all don't really have that. And so whatever up north ice cream y'all really like.
So anyone from Indiana can get it. It hasn't
okay.
to Ohio yet, unfortunately.
So anyways, like I'd buy a gallon of ice cream and eat all of it. And then those feelings of eating all that ice cream would probably lead me to feel like, wow, like I am so fat. Like, why did I eat all this? And then it's like that continued negative process. So if I try to target working on those thoughts, so if I failed my test and I changed my thought to, okay, it was one test, I still have a B average, I have a couple other tests, I can get tutoring, then those thoughts would lead me to feel maybe content, maybe hopeful. And then those feelings, instead of going and buying a gallon of ice cream, maybe I'll go buy a pint of ice cream and I'll eat that. And so when we start to target those feelings at top, then it's like a trickle effect for the rest of it. And so maybe like something, if you have a patient who tore their ACL and they can't play the rest of their soccer season, what kind of thoughts, and anyone can answer this, like what kind of thoughts do you normally see through your patients when they have those thoughts or when they have that injury?
I'm never going to play.
Yeah.
Or I won't get back or anytime soon or anything like that.
Yeah, yeah, exactly. So I'm never going to play again. I'm not going to get back anytime soon. So what feelings do you typically see from them?
Like anger or sadness, one of the two.
Yeah, anger, sadness. And so what do they typically do when they're feeling that way or not do?
Sometimes they don't want to do rehab or don't want to do anything. They just want to give up.
Yeah, and then those feelings of wanting to give up, not doing rehab will just further, I'm not going to get better. I'm not going to play again. I'm not going to be the same athlete I was. And so what are some ideas that y'all think you could tell them to kind of help them reframe that thought process?
I think that really depends on the athlete themselves, depending on their attitude, whether it's a we'll get you back on the field quickly or that's we'll take it one step at a time. Just how they're viewing the whole thing, either the big picture or like one step.
Yeah, yeah, definitely depends on the athlete. And so once you kind of target those thoughts, so let's say someone that they need it like one step at a time, like, hey, we're going to focus on getting you to this point. And then, so if we focus on getting to that point, then hopefully it'll change them to feeling maybe that more hopeful, content, or okay, my life isn't over. And then that they'll be more motivated for treatment, and then it kind of like trickles down. And so that is more what CBT is. And then the other one that Beth was mentioning, dialectal behavior therapy, the best way I can describe that is if we were to have a scale where one side was acceptance and one side was change, DBT is trying to help people balance that acceptance and change. And so if we have someone who, let's say, has the ACL injury and they are having the hardest time accepting it, they're not going to be able to change or work through that until they learn to accept where they're at, and then we can start working on the change. And so trying to think of a way I could, does that make sense? Kind of, yeah. And so learning to help them accept where they're at in that moment, because let's say their ACL is torn and they are just having the thoughts that Reagan was saying, like, you know, I'm not going to do well, I'm not going to get back to the athlete I was, then they're going to have a really hard time working on becoming back to that athlete that they were, because they can't accept where they're at right now. So they're just like blocking everything else out and just kind of sitting in that. I don't want to say pity, because I know it's a really big deal when they have the injury, but just sitting and like wallowing in that of like, okay, like I have this injury, my career's over. And so if we work on helping them accept that, like, hey, like, yes, you have this injury. Yes, it sucks. Okay, like once you finally accept that, now we can start working on that change. And so that's kind of what DBT is about.
Awesome. Thank you for sharing that. We appreciate it. So I have a couple more questions, but I want you guys to be able to ask any questions that you have for Kylie, whether it be for things that are going on right now for either like some of the general things that we talked about within the pandemic, how to deal or work with certain patients who we might have some difficulties in, maybe the referral process. Kind of just whatever you guys are thinking about. Now's your time to pick her brain.
So I have one that like I kind of experienced last semester. Um, it was a patient. She was like having a lot of trouble back home with like past relationship stuff, and then like it kind of resulted into like injuries that occurred that also kept her from being able to play sometimes, which also led to more injuries. And her thought process was, I need to play, I need to get back. And then like whenever we tried to explain to her like what was best for her, she just constantly was like, if I don't play, like my life is over if I don't do this. And she was constantly having like the negative thoughts. So like what, like just from your perspective, or like what you would suggest, like what would be the way to go with that?
And so I want to make sure I understand right. And so
Yeah.
she was having problems at home, and then you said, did the problems at home influence her injury, or did she just like, was it one thing pile on top of the other?
So I don't really want to go too much into it, but yeah, like something happened at home, caused an injury, and then it was more injuries after that that just kind of like piled in because of that injury that she had at home.
Gotcha.
Yeah.
Okay, so kind of what I'm hearing, and this is based off just the information that you've said, it sounds like she was using her sports as an escape from her problems.
Mm-hmm.
And so I think that kind of goes back to the acceptance and change of DBT, of like accepting what happened and working through and processing through those emotions and feelings from whatever it was that happened in order for her to change. Because if she keeps kind of like suppressing it and not wanting to talk about what happened or the injury, and just like, no, I just need to focus on my sports, I need to focus on this, then that stuff is just going to keep building up, and things are going to slowly start piling on top of each other. And so just kind of, I guess, encouraging her, either with you or with a mental health professional, just to talk about like, what was it like for you to go through that injury? Or, you know, how are you feeling since something that happened at home is affecting your athletic abilities right now?
Okay. Thank you.
Yeah.
Okay, so I have some questions about your dog.
Yeah. I love questions about Stella.
Okay, so like eventually I want whatever dog I have to be like a therapy dog.
Mhm.
But like what do I have, like what are like, I guess I don't know where to like start on like what
Yeah.
to do.
Like the steps for it. So each state is a little bit different. And so I think it'll, one, depend on what state you're in. But two, it kind of comes down to the temperament of the dog. And so when I first got Stella, I was in high school when I got Stella. And so I wasn't really thinking about my future with her. But when the longer I had her, the temperament I saw, like she was very calm. She did not get like overly excited when she saw people or other dogs. Like she just had a very calm temperament. And so I think the first thing when looking for a dog is looking at their temperament, which I know can be a little bit difficult with puppies, just because puppies are like always really excited. But just trying to, trying to find a dog that has a very calm temperament. And then once you go through that, I recommend waiting until the dog is at least 2 years old. You can go ahead and start putting them through training, like a puppy training. But the therapy training, I would wait until they're a little bit older, just because for those of you who've had a dog or have grown up with a dog, they tend to mellow out kind of around the 2 years and get their puppy energy out, which is a lot more helpful when you're working with clients, just because let's say you have your therapy dog in the training room and someone's working on stability and your dog sees someone walking and gets really excited, they can knock your client over and then like re-injure them. And so you want to make sure that the client, or not client, the dog, can be calm and still. And so putting them through obedience training. And so like I just did obedience training at PetSmart. It was cheap, it was good training. And we went all the way through beginner, intermediate, advanced, and advanced 1. And then to get the Community Canine Good Citizen certification, you have to go through the American Kennel Club, which is AKC. And then you can just look up someone in your area that does that kind of certification. So kind of in short, so finding a dog with a calm temperament, putting them through obedience training, making them Community Canine Good Citizen certified. So you have Canine Good Citizen, and then you have Community Canine Good Citizen. The community is just one step above the Canine Good Citizen. And then depending on what state you're in, some states require that you get specific therapy training. Texas doesn't. And so Stella did not have any specific therapy training, but she, like, her temperament is what made her really good at it, because she just was really calm, but she was also excited to see people but wouldn't jump on them. Does that help?
Yeah. So do you have to get like, so the Canine Good Citizen, do you have to get that first and then get the community one? Or
Yes.
yeah, okay.
Yeah. And so basically what the Canine Good Citizen and Community Canine Good Citizen is, it's a 10-step test. And so there's things like, I can't remember which one was on which, but like you have to walk your dog by another dog and they can only sniff them for like 1 second and then keep walking. They have to be able to sit on command. They have to be able to stay on command. Just different things like that, that if you think about, like if you're in a work setting, that dogs need to be able to do.
Tyler, you have a little bit of work with Remy to get to that stage. He just got a German Shepherd puppy and she's like 4 months old. So
Yeah, that's very true. Just fast.
I love all dogs. I welcome any questions.
any other questions from anyone right now?
I actually have a question. So we, as Beth said earlier, we are trained as athletic trainers to recognize those signs and symptoms of mental health issues and to refer them on. What do you recommend, or what are some good ideas as to help get us from point A to point B? Because I think that seems to be, the hardest thing as an athletic trainer is, okay, I recognize it. I know I need to refer them, but getting them to that referral sometimes can be a challenge because they may not want to, or sometimes it takes 3 weeks to even get them into that person that we want to refer them to, just because mental health, especially in our area, we just don't have a lot of options for those. So what do you recommend as healthcare providers to kind of get them to that next step?
Yeah, and it can be really hard, especially if you have someone who's resistant. And so my first option is always to have open communication with your client or your patient. And so if you're noticing these things, just simply kind of reflecting back to them like, hey, like, I noticed that you're really hopeless right now, or I noticed that you've lost a lot of motivation. And then kind of just talking to them in an empathetic way, like, hey, I recognize this is where you're at, and this is what I think is going to be helpful. Now, if you have the clients or patients who are like completely resistant to mental health and like do not want anything about that, that's where it can get a little bit tricky. And so I think if you, like, let's say you have a really good relationship with them, but you know someone who has a little bit better relationship, I think, and I know confidentiality wise, but if they have like an emergency contact, or like if you think their coach has a better relationship with them or can get through to them more, maybe sitting down and having like a group conversation, the three of you, like, hey, this is what I've noticed, and being in this position, I've seen a lot of athletes who go through this, and so this is what I think is going to be the most helpful for you. And having just that open and honest communication. In regards to getting into mental health quicker than like the 3-week wait, just I would say reaching out to your community, find other providers out there, host things, or invite mental health providers to come talk to y'all. And Beth, that might be something you can do. Just making there be more awareness in the community, like, hey, we're athletic training, like our athletic training department, we're wanting to get in contact with more mental health providers. And that way you can be more well-versed and know some more people, but then also too, that way you have more options to give your clients or your patients. Like if you have a female athlete and you need a female therapist, that way you have a couple different ones, maybe rather than just one. Or like if you have a male who wants to work with another male, like that way you have kind of multiple options. And so I would just say reach out to the community, because I know that there's therapists out there, but they maybe don't market themselves as well as they should. So just kind of reaching out to see like, hey, is there anybody else out there? Hopefully that helps.
Kylie, from a confidentiality side, I feel like this can be a really tricky thing for athletic trainers in general, because we always have that coaching report that everyone wants to have no matter what level we're at. And it's a whole different story, but even the line of like what information orthopedically we need to be giving a coach based off of patient's privacy and what the coaches feel that they deserve to get, and especially once you're working into the collegiate setting where they think that they're theirs because they're paying for them to be there. But when we have a patient who is undergoing any sort of mental health services, how do you recommend a conversation or go about with coaches or other personnel who, may want to know why certain people are not at practice or why they're not doing as well, or, as far as information that we can and give, and versus like how to also tiptoe that line around of like, we really don't want to tell you anything right now, but that's a really uncomfortable conversation to have.
So real quick, just to clarify, so are you asking like in regards to their mental health, or is it more to just with any kind of confidentiality that you'll have to deal with?
I would say more just mental health, because I mean, we get it with orthopedic all the time, but I feel like that it's pretty obvious. If you sprain your ankle, most people are going to be able to see that bruising, that swelling, that limp. And so coaches, I feel, oftentimes really easily relate that to clinical practice because they understand and appreciate that. Whereas like, depending on the coach, patient with some mental health concerns, they're not always visible. And also the patient may not want the coach to be involved as part of their care team. So navigating those tricky waters with that.
Yeah, that can be very tricky. So like one thing that kind of came to my mind when you were talking about that is when I have parents who come in and their kid is like clearly needing some help, but parents are just completely ignorant to it or oblivious or just not wanting to accept it. And so the way that I have to describe it to parents is like, and I relate it back to like physical symptoms. I'm like, physically or like to the eye, we don't see anything that's wrong right now. We don't see a bone sticking out. We don't see them limping. We don't see them hurting or like having trouble sitting or standing. But there is some stuff that's going on inside of them that is hurting them that we just can't see right now. And so maybe kind of phrasing it in a way like that to help them kind of conceptualize like, okay, like I don't see anything physically right now, but there is some pain that's going on inside, which it's hard when it kind of depends on case by case on what each athlete would want their coach to know and not want to know. If it's something that they're okay with a little bit more being shared, just saying like, hey, right now for their safety, they need to be doing this. For them to be to the top athlete that they need to work on the mental health side of it too. And kind of just going into like advocacy mode. And it's kind of hard to answer that because like each case would be different and each athlete and each coach would be different, and kind of just the way that you would phrase it more to them.
No, thank you. The general concepts, though, I think are something that, I mean, I know I struggled with as a clinician, and I had multiple conversations with students about, this line of they want to know and they think they need to know everything. And so it's just a really difficult line that if a patient does trust us with information of what we can share and what we can't share.
Mm-hmm.
Kind of going off of Jenna's question a little bit, when we look at that line of emergency referral versus just like knowing like, hey, maybe we can wait out the 3 weeks potentially that we could be dealing with if our campus's clinic is that full, or various options like that. What are some big things that you would say we should really be mindful of as athletic trainers during that time in case we are not able to get somebody in as quick as we would love to see?
Yeah, so kind of before I answer that, so when you say you're trained and stuff, and so are you familiar with like the Columbia Suicide Scale, like the questions that are on that?
I am, and we briefly I talked through it with, so we have a couple different schools represented here, so I can only speak to a couple of us. So I taught through those without giving the name of the scale to Ben and Dalton. And Ben actually probably does some of this with his work too, I would get, or at least is around it at work a little bit. So I know they know it. I haven't done anything with the first years yet. And I'm not sure about some of our guests, what they've done. So it'd probably be something really helpful to explain.
Yeah. So that is always that's something I kind of, not in depth of the suicide scale, but basically the basic content of it is something that's really, really helpful, not only with your athletic or your athletes, but also just with friends and family in general. And so kind of going back to the beginning of what I was talking about is noticing a shift in mood or behavior, just asking the questions. And so the way that the scale is laid out is it starts with like very passive minor thoughts and works our way down to all the way like having a date time like set for plan. And so the big thing when working with your athletes or friends or family, like if you suspect something, is if they have the thoughts, if they have intent behind it. So meaning like, I'll get to that in a second. So thought, intent, a plan, and then a detailed plan. And so the first question on the suicide questionnaire is, have you had a wish to be dead or to go to sleep and not wake up? And so kind of just like asking a question like, hey, you seem like really upset. Like, have you been having any thoughts of like wishing you could go to sleep and not wake up? That thought is a little bit less intrusive and aggressive than, have you had thoughts about killing yourself? And so starting off with that kind of like opens the door for the conversation. And so if they're like, yeah, like I don't want to get up in the morning, like I'm having a really hard time doing anything. And then you can kind of move into the next question, which is, have you had thoughts about actually wanting to kill yourself? And so the thoughts of like wishing I could go to sleep and not wake up, just wishing I was dead, those are a little bit different than thoughts of wanting to kill ourselves. I think every now and then everybody has a thought like, oh my gosh, like I just wish I was dead, which is very different than I want to kill myself. And so kind of distinguishing between those two thoughts and like where they're at. And so if your athlete or someone you know says like, yeah, I've had thoughts about killing myself, that's when you need to figure out, is there intent, is there a plan, and is there a specific plan? And so when I say intent, like, is it a thought that they just have, like, I want to kill myself? Or is it a thought like, no, I think I actually want to do this? Do they have a plan of what they would use, where they would do it, what time they would do it? Do they have a date set? And that's when the plan starts to get into more specifics. And so really the big thing, like when working with people, is assessing, is it that passive thought that like, oh, I just want to kill myself? Or is it a thought like, no, I'm having thoughts about really killing myself? And so I would say as athletic trainers, familiarizing yourself with the Columbia Suicide Scale, and I'll actually send a copy to Beth, or you might already have one, Beth, if you said you work with it. But just kind of familiarizing yourself with those questions can be really, really helpful when working with someone who is starting to have those really scary suicidal thoughts.
One of the things I had to do that in my education with this, because it's not something that athletic trainers are always around as much as someone in your health field would be, was actually to practice saying it in front of a mirror, and or saying it to someone that we knew was not at risk, but just getting comfortable by having the words come out of your mouth. Like, are you thinking about hurting yourself? Are you thinking about falling asleep in a deep sleep and not waking up? Because it's not something that's ever fun or comfortable to say, and you get those like awkward tongue twisted moments of like, oh, I just said this. And so doing things like that, at least that's how I was taught on it, or had to do for a project one time, to be able to get a little bit more comfortable and using that terminology and language. So that's all the real questions that I had for Kylie. I don't want to cut anyone else's questions short though. Does anyone else have any questions about what she does, about what athletic training needs to look for, our relationship with mental health providers?
I have a question. So I was thinking, I don't know, kind of going off of everything that you had already said, but thinking about like substance abuse or like drug use, would that just be like the same game plan as you had mentioned previously, like sitting down with the patient, talking to them, and then just finding the best care provider, or what's like the best way to go about that if you either notice something or like someone else comes up to you and says something about them and it's concerned about them?
Yeah, definitely like with substance abuse and things like that, basically everything that I go back to, like my principle I stand is open communication and honesty. And so let's say that you have an athlete come in and like you just notice they're acting a little different than usual, like they're getting angrier quicker, they have a short fuse, maybe they're like more lethargic, whatever it may be, communicating back to them what you're noticing. So not just going in and I'm not saying that you would do this, but just not going in and being like, are you using, just asking them like, hey, like I've noticed over the last couple weeks, like you've had a quicker temper, maybe you've been getting angry at your teammates, like is there anything going on? Just kind of asking it in that standpoint and be like, you know, working in this field, like I've seen when people use steroids or whatever it may be, like, and I'm noticing some of those symptoms, and I just want you to know I'm here to help you. Approaching it like in a very empathetic way, you'll more likely get a good response than like the what, no, why would you think that, like getting the more defensive response. And so yeah, just talking with them, and then if they say they are, then that's like kind of going back to, I think it was Jenna's question, like reaching out in the community to figure out like what therapists have different specialties. Sometimes there is addiction counselors, sometimes there's specific like sports psychology, sometimes there's people who work with athletes of this kind. And so like you can find little niches depending on where you're at and the providers that are in that area. And so just familiarizing yourself with the providers, that way if that comes up, you can be like, hey, like I know this really great therapist that works with people who are struggling with this, like let me get you in contact with them. And I would almost suggest too, like if you have a client who you feel a little bit hesitant on if they'd actually reach out, why don't you and the client like go in the back room or like where no one else can hear, and then y'all call them together. That way they also have some sense of support, like, hey, okay, like this is a really scary time right now, but like I trust and know this person, they work with me all the time, we're gonna call this person together, we're gonna call this mental health provider together. Good question.
Before we go, does anyone else have any questions they want to ask Kylie? Awesome. Well, thank you to everyone. Thank you so much to
You're muted.
I just muted myself. I literally double clicked the button. Thanks to everyone who joined us outside. So